Separating the right ventricle from the pathway to the lungs is the pulmonary semilunar valve. This valve prevents backflow of blood into the right ventricle during ventricular relaxation or diastole. The pulmonary valve allows passage of blood into the pulmonary trunk. The pulmonary trunk is a large vessel on the anterior superior portion of the heart that directs blood to the lungs. The two main branches of the pulmonary trunk are called the pulmonary arteries. As we breathe, our blood exchanges carbon dioxide for oxygen. This oxygenated blood makes its way back to the heart via the pulmonary veins. There are two veins from each lung that return oxygenated blood back to the third chamber of the heart. The third chamber of the heart is called the left atrium. It looks like it is found on the left superior portion of the heart, but when lying in the body, the left atrium is the most posterior of the four chambers. Just as blood passed through the tricuspid valve from the right atrium to the right ventricle, the blood passes through the left atrioventricular valve, bicuspid valve, or mitral valve as it goes from the left atrium into the left ventricle. Jonathan.
Here.
David?
Here.
Heidi.
Here.
Left atrioventricular valve.
Here. But you can call me bicuspid valve or mitral valve.
Bicuspid valve and mitral valve?
Yes, or the left atrioventricular valve. I go by all three.
The last chamber located on the left inferior part of the heart is called the left ventricle. The bicuspid valve has two leaflets. As the left ventricle contracts, the blood is forced through the aortic semilunar valve. This can be found on the inner superior portion of the left ventricle. Blood flows through the aortic valve into the ascending aorta during systole. The ascending aorta can be found posterior to the pulmonary trunk. The aortic valve prevents a backflow of blood into the right ventricle during ventricular relaxation or diastole. In fact, there are little entrances, each called an ostium, in the wall of the right and left sinus of the aortic valves. The heart receives its own blood supply through these ostia, which lead to the right and left coronary arteries. Deoxygenated blood from the heart muscle returns to the right atrium via the coronary sinus. Remember that structure? An easy way to remember the order of blood flow through the atrioventricular valve is the mnemonic you always want to try before you buy. The blood flows through the tricuspid valve, pulmonary valve, bicuspid valve, and aortic valve.
Hi, how can I help you?
Hi, I'd like to try some of the chocolate lava fudge.
All right.
Thanks. Oh, that's pretty good. But I think I'd like to try some of the white one as well.
All right.
That's pretty good too. But I think I'd like to try one of all of them before I buy.
As we move up the aorta, we notice that it begins to arch over. The arch is called the aortic arch. The portion of the aorta after the arch that descends and continues inferiorly until it divides at the legs is called our descending aorta. You probably notice three branches coming off the aortic arch. If you can remember your ABCs, these arteries should be pretty easy to remember. A stands for ascending aorta, which we've already seen. B stands for brachiocephalic trunk or brachiocephalic artery, the first branch of the aortic arch. This supplies blood to the right arm and head. C stands for the left common carotid artery, the second branch coming off the aortic arch. This supplies the left side of the neck and head after bifurcating into the internal and external carotid arteries. And S, remember ABCs, stands for left subclavian artery, our last branch of the aortic arch. This supplies the left upper limb. On the right side of the body, branching off from the brachiocephalic trunk, is the right common carotid artery and the right subclavian artery, which I'll come back to shortly. The right common carotid artery also bifurcates into the external carotid artery and internal carotid artery. The external carotid artery is the more anterior of the two branches. They can be found on both sides of the body.